much what you would think an adhesive would be. It would bond two surfaces together. There are specific types for the dental world. The types of bonding, they have micromechanical that actually creates like a roughened surface. So we call it etching usually, and that will help grab the adhesive and hold it to the dental tubules or the enamel. You can't see any of this stuff unless it's under a microscope too. Okay.
Can you guys hear Miss Evie?
Yeah, sorry. Let me know. I'm not really good at shouting at. Oh, dude, that might be a little, yeah, that's and then you have macro mechanical bonding. This is what our cements are primarily made out of. Okay, so we kind of went over this. Retention of restorations. We have veneers, onlays, crowns, bridges, ortho brackets, and composites are all within this realm too. And then there's that fun word again. Micro leakage. Keep it in your brain, okay? So that's when you have an influx of fluid and then it pushes out over and over, and that's when breakdown and bacteria gets into the tooth. So adhesives' job is to reduce this, because you know when you have an amalgam, it's only mechanical retention because you pack it in there and then it hardens. These are actually glued in and it seals. Okay, that's the difference. So it also helps aid reduction of recurrent decay. That's if the patient complies with home care. I mean, anything that we put in the mouth will eventually fail because it's not what God gave us. So it's all about how the patient keeps it clean. So that's where you guys come in, okay? So there's percolation again. That's just basically hot to cold, okay? So, historically, they've been around for a while. Acid etching was pretty much the first one, and that's that micromechanical. Then we went into chemical adhesion, and that's this polycarboxylate. You guys say that word? Polycarboxylate cements, and then you have glass ionomers. And we'll have a lab over some of these cements too, so you get to know these too. Those actually do a chemical and mechanical bond. Okay. And then we have dentinal bonding agents. So, like I said, started out with the acid etching in the 50s. Then it evolved into macro mechanical retention to micro mechanical and chemical, and then the substitutes of polycarboxylate and glass ionomers. This is just an acid with either a zinc oxide or a glass powder, and that's that chemical composition of it. Okay. Sometimes these will cause hypersensitivity because of this acid right here.
Is that the one you have to mix on the glass slab?
One of them, yep.
Yeah.
It's fun, right?
That's hard.
Yeah.
Yeah.
You have to do it just right. But we'll have a lab on that, so
Okay.
we'll have fun with it. Okay, so your surface, as you guys know, cleanliness is always important. You want to get it as clean as you possibly can, and you'll get the best adhesion that way. You also need to keep it dry too, and that's hard in the mouth, and that's why we'll go over isolation. Okay? So biofilms, they actually, as you know, create a film, and that disrupts adhesion. So you never want to just go in without cleaning the tooth and etching it and putting a restoration in. Okay, so adhesive failure occurs if the break occurs at the interface. So it doesn't damage the tooth, it comes off clean. Cohesive failure happens within the bonding material and what you're trying to glue to that. Does that make sense? Cohesive, two things. Adhesive failure, just one. But cohesive can also result in the breaking of the tooth, and that's where we get into that bond strength. What we talked about last week, tensile, stress, those things. So if you have an adhesive that's not strong enough to be in the posterior, you're going to have failure. Make sense? Okay. I know, it's a lot.
So adhesive failure is just like or like damage, like not damaging the tooth essentially, whereas the cohesive failure is going to damage and affect the strength, right?
So adhesive would be like your glue doesn't stick,
Okay.
in simpler terms. Your cohesive failure would be when both the glue and what you're gluing it to,
Like the tooth, for example.
Mhm.
Okay.
they don't mesh well.
Okay.
Okay. Doesn't necessarily have to be a break on the tooth,
Okay.
but if the bond strength is good enough for the tooth, but it's not good enough overall with the stress, that's when the tooth breaks.
Okay.
Okay?
Yeah.
So ortho brackets are usually adhesive, right?
Yeah.
A big class 2 composite in the back, cohesive usually. Okay? And you can only glue so much stuff together too. So if you've got like a spike of enamel left, a tooth's probably not the best candidate for a filling. Okay? Because you're hoping that your glue and your resin withhold the structures of what the tooth once was, and now you only have a wall of enamel. Does that make sense how that could just blow out real easily? Okay. So, and pretty much just said this example. So, if you read this, if the bracket is adhered to the maxillary premolar with the cement but falls off in a few days, what kind of failure would that be? Just falls off. Yeah, perfect. So if the bracket's clean and contains no remnants of cement, the failure was adhesive. But if the cement layer remains on both the tooth and the bracket, see how that could also be cohesive? Because they're not coming together. Alrighty. So let's talk about etching. This is what we're going to do today. So your tooth enamel, as you know, is highly mineralized. So if we put an acidic solution on it, it's going to open up these tubules. It's also going to dissolve away just a little bit, not a lot, don't freak out, but it allows the material to get into those tubules easier, okay? Because you need a certain depth as well. So we call them enamel tags. We use 37% phosphoric acid. It's usually about a 15 to 30 second. And then we rinse it off. And then once it's done, you'll get a nice frosty, white, rough surface. Anybody ever gotten their nails done? Do you know how they will scrape your nail beds first? Because they want that monomer to stick on there. Okay, so the process goes: clean the enamel, rinse thoroughly. Sometimes we can use pumice. The air polisher is available to you guys if you're going to do sealants, especially on kids. Sometimes there's like Oreos, Cheetos. They come in, mom's like, they needed a snack. You're like, thanks. So now you got to dig all that out, because that's why they need sealants. It's going to sit in those pits, right? So whatever you got to do to get all that out prior to even putting the etch on. Because if you put the etch on over top of the Cheetos, is it going to go through? Mm-mm. Okay. Got to dry it. Then you apply your etch. Then you rinse. Then you dry. That's where you get this white frosting. And we'll see it on a picture here in a second. Now, if you're going on and doing a filling, you apply your liquid bonding. This is when it will seep into those tags. Then you light cure it. You give it a light air dry, and it will actually appear shiny, almost wet, and that's the look that you want. And then you cure it. And then you pack in your material. Small increments. Cure, cure, cure. Small increments. Cure, cure, cure. You can never cure enough, right? Okay. This is what it looks like. See this frosty? Now, this is a little overkill. I want you guys to stay in the pit, in the fissures. You can come up a little bit, but this is a total etch. Maybe they were doing an occlusal stop, like in ortho. They'll have to do the whole surface. But I want you guys to stay in the pit, because if you etch everything, where do you think that sealant material is going to go? Everywhere. And then they go to bite down, it's open. So we got to grind all that away. So this is a microscopic view of what these tags look like. Alrighty? The mountains and valleys. Okay, so there's techniques too: total etch, selective etch, and self etch. And so, I've got a YouTube, I can get that there in a second, but we'll watch a little video on that if we have time. So, dentinal bonding. This is when we're doing deeper restorations. This came around in the 80s. This also requires etching. This is micromechanical and chemical. It can actually bond amalgam, composites, and cast restorations to teeth. So we have a lot of self-etching, self-bonding cements these days for crowns and stuff like that. A lot of them come in like a 2-tube push, and then the tip will mix it for you. We're gonna do it the old school way. We're gonna mix a little bit of powder, a little bit of liquid, but it's evolved into these newer technologies. So we still have to etch, prime, bond, and usually some of the older materials are 3 steps. Now we have 2 steps, and now we even have a self-etch, self-prime, self-bond, all in one. Then we throw in the restoration. But it's mechanical bond to the tooth and a chemical bond with a composite.
That's an important statement.
You see that?
Everybody. Where do you get mechanical bond? The tooth.
The
The
tooth.
tooth. So then you have the dental bonding with the composite. What kind of bond is that?
Chemical.
Chemical. Thank you.
One way I remember this in school, mechanical, made me think of like man-made, like men, mechanical. That's going to be to the tooth. Chemical, composite, something that's not or it's technically man-made, but it's manufactured, artificial.
So I don't get it.
So,
Like, why is it important?
well, you've got both of your bondings in one thing. So without one, can you have the other? So this part has to bond to the tooth. Once that bonds to the tooth, this reacts with the chemical bond to bond to the composite to hold that
The
into the
dental
tooth.
bonding has polymers that mix with the composite material, so that makes it a chemical bond as opposed to a mechanical bond. The mechanical bond is etching to the tooth, and that opens up those jagged
Enamel tags.
rods so
Think of
that
it-
they lock in. Does that make sense, Johnny?
Yeah, a little bit.
No, you're lying. So think of it this way: mechanical bond will change the structure,
Okay,
roughen it. Chemical bond,
so that's your acid etch?
Yes.
Right, okay.
that chemical bond will not change anything. It will just bond what you need within that tooth in order to restore it.
Okay.
Okay, and they have, like she said, they have polymers within it to make it bond to both sides.
Okay.
Does that help?
Mhm.
Okay. I know you have to say it like 5 times over before it starts making sense. So this is just a graft of whatever type of agent you're using. They have 3 steps. That requires etch, prime, bond. 2 step, the etch, the prime, and the bond are combined. And then you have the single step that I was telling you about. A lot of younger practitioners, they know this technology more. They'll go straight to the 1 step. A lot of the older ones, tried and true, they've been doing it for 50 years, hasn't failed yet, so they may require you to do all 3. It just takes a little extra time. Okay, let's talk about the smear layer. This is debris that will get into the tubules once the tooth is prepared. Okay, so it's like cutting the tooth, it's tooth debris, it gets down in there. Do you think that's gonna hinder the bond?
Yeah.
Yeah, so we want that out of there. So a lot of times the acid etch that we do, we'll pull that out. They have some that will change the smear layer a little bit and deepen it, so it's still technically there, but it will bond to it. Some practitioners think that because you've occluded those tubules, you'll have less sensitivity with a more natural resistive structure, as opposed to completely blowing it out and putting a chemical bond in. Does that make sense? Okay, so it all depends on who you work for.
So, if I got rid of the smear layer, is that total edge or modifying the smear layer? Pardon me?
Modified?
If I got rid of it?
Got rid of it completely. Bye-bye, gone. Just go back.
Oh,
So the
okay,
tunnel
rid of
edge
that
because it's on the
completely.
same surface, right?
Okay, if I didn't get rid of it completely and I left a little bit of it because I wanted to protect the dental tubules, but it's still gonna have some adhering capabilities,
That'd be
what have I just done?
Modified.
Modified. Okay, and so the modified layer is sometimes known as the hybrid layer, okay? Note to self, note to self.
Okay, wait, I think I'm still confused on this.
Okay.
Like, what is it? Like,
Do you
I
not
just-
understand
No.
any of it? Okay. So when a tooth is cut,
Mhm.
you're gonna have stuff,
Debris.
debris.
Okay.
Okay. Remember what the tooth looks like in cross section? Like you're holding a handful of straws.
Mhm.
Okay. That stuff clogs those holes.
Okay.
Okay. We need those holes open sometimes to get all of our adhering material in there.
Mhm.
Okay. Without that, our adhesion is not going to be good. But they have products that will allow you to have a little bit of that layer, and you can still adhere to it. So say you're closer to the pulp, sometimes you want to leave that smear layer because you're like, this one's going to be touch and go.
Okay.
But if you're well within the enamel, you don't need protection because you still got lots of dentin left. Does that make sense?
Okay.
More sense?
How do you, when, like, dentist or, like, shaving that away, how do they know if they've gone home with through the smear layer or not?
How do they know?
Can you repeat the question so we can hear it back here?
She's
With
asking.
the smear layer, when they get rid of it, they get rid of it, right? Some materials you have to get rid of it completely, some you just shave it down, right? Well, how do they know when they have shaved it down, like, or if they've only
If they've gotten rid of everything,
Yeah.
it's the type of product they use. Okay.
What do you mean?
So there are products out there that will completely take all that out, and there are some that will leave a little bit of
There's
that.
plenty of products that get rid of the smear layer.
Do you guys, have you heard the terms hydrophilic and hydrophobic?
Mhm.
Okay. Okay, so this gives you a better idea of the modified. So Haley, look at this. See how this dips down? So you're still gonna have adhesion here. And I don't know, you guys probably can't see these slides too great, but can you see them on the PowerPoint okay? If you have your PowerPoint
It
on.
looks exactly like that.
Okay, let me try to outline it. Do you see this little bit? Yeah, right here. That represents that one. See how you can't really decipher where the tubule is? Because it's completely, it's left. This is a smear layer that's left. This one scooped out, modified.
Okay, so the one on the far left has no smear layer, right? Right here, it does.
This one's completely occluded with, so this would be your tooth structure. This would be your debris that's left.
Oh, okay.
So
And
that's what it
then
looks like.
It's, oh, this is the process.
Yes.
Of it, okay, I see.
Yep. Okay, so this is actually a composite in cross section. So here's your tags, here's that hybrid layer Mrs. Rapey was talking about. Here's your adhesive, and here's your composite. See how microscopic all this is? And then they expect you to keep it dry. Why don't you do it? Okay, so other materials that bond, there's that word again, polycarboxylate cements, glass ionomers. These are basically chemical adhesion with mechanical retention. So, what does that mean?
I mean, you think you get one thing down.
I'm gonna just throw this
Yeah, you
out.
throw another one at you.
Is it that there's like a chemical like reaction, but it still bonds to the tooth?
Which makes it mechanical.
Because it's directly against the tooth, that's what makes it mechanical.
So
So
the
think if you're
chemical-
gluing something on, not in.
Oh, okay.
Does that help? Okay. So think of adhesion as sealants. Think of dentinal as composites. And glass ionomers are gonna be your abfraction, your cervical lesions. Because this area flexes and this is a harder component. It's not pretty, it doesn't polish well, but people don't care and they just want that sensitivity to go away. Glass ionomers are the way to go. Any questions? You guys probably hate me. You didn't know you're taking chemistry today, did you?
That's what's created after. An amortized is what's created after acid etch, right?
You got it.
Okay.
So, Kelsey, think of your nails getting done. You know how they roughen that up? Okay, that's your nail tech.
After, so they're like, you're saying like they were after this and that create this year.
And they file. Check because then it's gonna give you a rough surface.